introduce Mr. Rajeev Sadanandan, who is an old friend and a person who is a great inspiration to everybody in all areas of health. And he is currently the CEO of the Tata Trust-funded Health Systems Transformation Platform, and is also Kerala Chief Minister's advisor on COVID-19. He has previously led Kerala's health department and has been in the forefront of the fight against Nipah virus. He has been working and researching in the area of health systems, policy, and financing for over 2 decades, and he brings in that rich experience into the area of tobacco control as well, alongside non-communicable diseases.
Thank you very much. As someone who has spent some time working on tuberculosis control, on tobacco control, and as per the last GATT survey, our state has done a reasonably good job of controlling it. I'm quite happy to be talking today. I'm also happy to share with you the news that the UN Action Task Force on Control of NCDs has ranked the Health Department of Kerala as one of the 5 best performing states, governments in the world, and we're all quite excited about what's been done. So it's been quite tobacco control has been a major area for us. What we need to realize while dealing with tobacco control is that it is backed by a very strong industrial enterprise. They hire the best people. They have developed over years considerable expertise in management, in misinformation, in behavior change, political lobbying. And across the world, we know that they stop at nothing. And if we underestimate our enemy, we're going to be in bad trouble. So any response to them will need to replicate their reach and their techniques. And I would classify these levels as 3. One is regulatory, the other one is communication, and the third one is social mobilization, all of which have been flagged by the speakers who went before me. Nothing can happen without regulatory support. There, I must say that thanks to some very enlightened leadership at the central government level, we have the necessary legislative and policy framework built up in consonance with the Framework Convention on Tobacco Control. There are rules that ban smoking in public places, mandate very graphical, one of the most graphic in the world, depiction of consequence of smoking on packages, ban on advertisements, ban on sale of tobacco to minors, etc., etc. I mean, the framework is there. But even then, the last survey showed that 42.4% of males in India use tobacco, which shows that regulation is not enough. So what are the other things that we need to look at? As I mentioned before, the major reason is the powerful tobacco industry. They have expertise in political lobbying. They know how to create and use loopholes. They have outreach in every nook and corner of the country. Those of you who worked in tobacco control would know that practically every part of the state you may not reach, but they would have reached. The major tool that they use, and that's something that we need to be aware of, is to mobilize the persons whose livelihood would be affected as the consequence of the reduction in use of tobacco. And that is a group that has always been mobilized to respond. These are, of course, tobacco farmers, BD workers, retail vendors, and many of us working in this area have faced pressure from this group. They are effective in supporting mobilization of support of politicians, as some of the members of this panel would vouch for. Let me give you 2 examples of what happened in my chair. Can I get will I get a indication of how I'm doing on time? Is it okay? No, you're muted, Dr. Professor Reddy, you're muted. Professor Reddy, you're muted. You need to unmute yourself.
Well, since I do not have a clear idea of the flow chart of this session in terms of how much time has been
I'll make use of the loophole that you make.
Please go ahead. Please go ahead.
Thank you, Professor Reddy. Now, let me give you 2 examples of what happened from my experience. In 2016, before government did it, we banned e-cigarettes. The next morning, I get a group that lands up in my, all suited, booted, landing up in my office, congratulating us on the effort that we've taken on tobacco control and so on, and enlightening me that the use of electronic cigarette is actually a very good counterpoint to use of smoking. And actually, the benefit of use of electronic cigarettes is something that I was foregoing for the state. Fortunately, I had met this group in the past, so they and they left after. And it's interesting. They asked me, "Have you ever seen these cigarettes?" I said, "No." "Okay, here is one. Please take a look. You've banned it, but at least take a look at what it looks like." That and a year later, I get a call from a researcher in London saying that he would like to talk to me about the beneficial effects of vaping as against as against smoking. That the real shocker was about 6 months later, I get a call from the local chief of the all India radio, wanting me to participate in a discussion on how the risk of vaping compares with the and with smoking. That's a level to which all India radio is they're able to mobilize the all India radio to sabotage something that was happening. The other area was you would have seen these advertised on the top of these retail outlets. An NGO, but we have some very active NGOs. One of them protested. We got them removed. 6 months later, I find that a beautiful honeycombed design with red and yellow is there on the top of most of these shops. And I was enlightened that while I've not recognized what it is, it's a very clear subliminal message for smokers. That's the extent. They've been using nuts theory even before Nobel Committee heard of it. Now, history of tobacco is got full of misinformation. All of you are public health experts. I won't deal with it. The amount of money they spend on false research, the money they spend on media coverage and so on, and it has come down now. But for about from 1920s to 1990, they were able to successfully push down the link between smoking and cancer, and that's a tremendous feat. And my request is that let's not underestimate these characters. Now, who are the major players who can be used to counter this? First of all, the healthcare providers. It is important that at the primary care setting, healthcare providers are able to recognize the impact of tobacco connected to the disease and counsel them on prevention, because that's a point at which they're extremely vulnerable. As per a recent study, only 30% of our doctors do that. And this is an area where a major change needs to happen. The second one is that the industry, as we know, recruits people at a very young age cohort. And educational institutions are extremely powerful, extremely useful allies for this. We know that they can't sell within 100 yards of the education institution. So all education institutions must be mandated by the government to search for people who sell this and inform the police to take action. We've also seen that when classes are conducted for students on the dangers of passive smoking, the dangers to their families and so on, they act as a very effective conduit for carrying messages to the family. Again, another area that we need to work on. Police is an extremely crucial member, and I was hoping to hear the DGP before me. We've seen that wherever the NGOs are listened to by the police and take action based on the request, the message goes down real fast. As you know, in India, when police conveys a message, that message is very forcefully driven. We've also seen that after having worked with these NGOs for some time, police officers themselves develop a kind of missionary zeal and start driving the agenda on their own. And we couldn't ask for anything better. Under the Act, there are also other authorities like food safety officers and so on who can play a crucial role. Literature says that high levels of taxation are extremely useful. Now, if Kerala was one of the major reasons for success of tobacco reduction in Kerala was the activity of the NGOs, and they are very crucial because the reach of the industry is so much that government can never reach to these levels, whereas the NGO activists are able to come up with this, and they've been very effective in hounding the industry and bringing action to them. But all this would be inadequate unless the community is enlightened. I've seen that unless people step up on a public transport and ask someone who's smoking to stop smoking, someone who is smoking in a public places, he walks up and says, stop smoking. Then I'm convinced, yeah, we have a program going. The moment the community takes up, I think that is the best counter we have for the industry. I hope that in all the areas that we work in, because one messaging that has not gone out, and in fact, when we were talking about NCDs, the one dream thing that would have happened to us would have been the cessation of tobacco use. Alcohol comes far behind. If we can stop tobacco tomorrow, it would be a major achievement. It's a shame that what WHO calls, that the only product that can kill 50% of the users if it is used as advised by the manufacturer is tobacco. And if any of us who is mandated to control this is not doing it, I would submit that we are taking part in the crime. And I think we owe it to the future generations to ensure that we work on this. Thank you.
Thank you, Mr. Sadanandan, for that very rousing call to action. As you rightly said, those who do not do nothing to change society when change is needed are not actually guilty of inaction, they're actually guilty of a crime. So we don't want to be complicit in that. Certainly, we'd like to mobilize all sectors in order to bring about an end to the tobacco menace, which, as you rightly pointed out, is the foundation for many non-communicable diseases. And even in COVID-19, we recognize that the largest risk of severe disease and of high mortality is in those people who have NCDs as comorbidities. And therefore, not only in COVID-19, but even if you take the influenza pandemics, H1N1, H5N1, or any of the other major respiratory viruses, we find that the people who succumb most are people with NCDs. And since tobacco lies at the foundational base of most NCDs, we need to strike at that base itself. Thank you very much for this call to action.